My mother was a nurse, and obviously my father was a physician. So all I ever knew my whole life was the medical field. So, at dinner, we would talk about, the conversations would come up about some kind of surgery or whatever. So dinner conversations, I can remember that. And then when I was old enough to go to the hospital with my father, I would go meet him after Sunday school and do rounds with him and eat lunch with him on Sundays. And then as I got older, I worked in his office. I was, just always exposed to the medical field. Never, I became a nurse, but nobody ever told me that I needed to be, that that's what you're supposed to do. So it just is I always knew I was going to be a nurse somehow. I don't know. I guess just because of exposure. And then when I worked in his office, I did some nursing things they taught me how to do. And then when I went to college, then I came back here and worked as a nurse tech some. And then when I graduated from college, I went to work away from here up in Wilmington, or at Crozier and then Wilmington. Well, you have several years of the college courses, the Englishes, and then we had probably 4 semesters of nursing. I had some clinical at the Veterans Hospital in Ellesmere. I remember going to Christiana to watch, well, it was probably Wilmington Hospital then, or Delaware Division, or Memorial, can't remember, but to watch an OR there. I remember Dr. Whitney doing breast surgery one time. Then had a pediatric experience at Delaware Division. I worked rotating shifts, which they were 8-hour shifts. So you work days, evenings, nights. I frequently say there's several things in life I never want to do again. One of those is be a new graduate nurse, because you just don't know what you really don't know until you get into practice. So working on a medical surgical unit was, it's a good beginning point to get your skills together. Yeah, it's a challenge, because when you're in nursing school, you only take care of we probably only took care of one patient at a time. And when you go into nursing, I was probably taking care of 10 patients at a time. I always have enjoyed nursing. There's a great satisfaction you get from, I particularly liked working with the surgical patients, because you can see, you're doing things to help them. It might not necessarily be what they want to do, but what kinds of things you can do that's going to help them get better. So there's a real satisfaction in being able to do those kinds of things for the patient that is going to help them get better. When I was working in nursing, I mostly think about when I came back here. The physicians that we had on staff at the time were very good diagnosticians. So I don't know that when I was at Crozier and Wilmington, I didn't know the physicians as well. I didn't have as close association. But I know, particularly remembering when I came back here, they were just very good diagnosticians, so that maybe we weren't able to treat all the conditions that you would see here. But they were able to diagnose the problem, and we would send them to Wilmington if it wasn't something we could treat here. So I think it all boils down to respect. My experience has been when you work in nursing education, you're kind of teaching the person to think like a nurse. And my experience has been with the men, just because of the difference between a man and a woman, they would have the most problems with like writing a care plan, because you have to follow the instructions but it's a whole building block process to make the person think like a nurse. So you have to teach them about nursing process, and part of that is to write the nursing process. So they would, there's a lot of detail that's required, and they were the kinds of things that they would tend to struggle with, just because they would have to follow the instructions and the detail that was required if they weren't that kind of a person. We've had students who have gone on to be nurse anesthetists, nurse practitioners. I'm not aware of any that have gone on to be a physician. From a personal perspective, the nurses in the hospital, I am not sure, are really in touch with. You give instructions to the patients, but I don't think they have a sense. I mean, we have case managers that are very good about what it's going to be like for that patient to go home, expecting that they're going to do all these nursing things at home. So from a personal perspective, I've had two experiences in my own life, one with my mother when she was sick, and my mother-in-law, and it took all my nursing skills to get things organized and make sure they got their medications and the care they needed. So the things that patients are expected to do at home now are kinds of things you used to do in the hospital. So again, it's because we have to get them out of the hospital because insurance isn't going to pay for them anymore. But the home health care nurses are excellent at being able to teach these people how to do these things at home that we used to have to do in the I didn't think that people could do at home, but they can. It's amazing. The new drugs are a good thing, but they also seem to be, it's kind of scary now too, now it's like all of a sudden they seem like they were a good thing, and then all of a sudden now there's side effects that it's like the screening of the drugs. Sometimes they turn out to be, there's some complications that maybe somebody knew or didn't tell us, or you're going to have side effects of drugs that over time the drug works the way it's supposed to, but over time then you start to have side effects of the drug. So I'm saying in my lifetime as a nurse, there have just been an explosion of new drugs. So my concern is, on one hand, it's really good that we have all these new drugs, but my concern is, have we done enough research on those drugs? Are there going to be more problems with those? It seems like just things are we're starting to have these problems with these drugs. So it's really good on one hand, but it's also kind of scary. It's wonderful that we have the drugs, but then it's also scary. It's like, have we gone too fast? Delaware Academy of Medicine has always been kind of our history keeper for medicine, and they were kind of educating. I think they were responsible for educating the physicians, or the, educational conferences would come out of there. And for nursing, it was Delaware Nurses Association was kind of our organization that was responsible for educating the nurses. So it's always kind of been Academy of Medicine was.
Delaware Nurses.
Yes. It's not in Delaware, because we're such a small state. It's not that's a problem in that we don't. Nurses are busy, so it used to be that you would have nurses that were more active in that organization.